Medicare open enrollment for 2020 begins today, and for millions of older Americans, it's a good time to review health insurance options and to cut costs if possible. CNBC senior personal finance correspondent Sharon Epperson is with me now as part of CNBC's Invest in You series in partnership with Acorn. So Sharon, big day, big season, obviously, and especially with the Democratic debate, we're going to hear a lot about this topic. Average couple this year expected to shell out over $285,000 in health care costs in retirement, even if they qualify for Medicare. So what factors determine how much you'll spend?
Well, one of the first things you need to do is just kind of figure out how healthy are you? What do you spend your money on in terms of health care, in terms of prescription drugs? Do you have a chronic illness? Your health status is key to determining how much you're going to have to spend. Your age is also, you may want to retire early, but Medicare kicks in at 65. If you retire early, you got to figure out how you're going to pay for those health care costs. You also have to consider what your retirement income is. The higher your income, likely the higher your premiums. So how can you make sure you manage that retirement income to keep your premiums down as well?
So speaking of that, what are some ways that people can save money on this?
Well, one of the things you have to know is what you're getting in Medicare. Original Medicare is parts A and B. Part A covers hospital visits, Part B covers out-of-patient visits, and then there's a Part C, that's Medicare Advantage. So it's more like an HMO where you can pick your own doctors through a plan, but you want to make sure you stay within that plan to keep costs down. Part D is prescription drugs, and that changes depending on how healthy you are, what your illnesses are, what medications your doctor has prescribed, and then prescribe new ones. You want to look at that particularly every year because that often can change, and you want to be in the lowest cost plan that you can that still provides you the drugs that you need. And if out-of-pocket expenses get to be too much, you want to figure out how to pay for that. A Medigap policy can also help with that original Medicare plan.
And so we were talking about United Health, which is a company obviously that shares doing well today. They're citing Medicare Advantage plans. It's been a strong part of the market.
Yes.
What options do people have these days when they're looking at those Medicare Advantage plans? I mean, what are they offered?
Well, they're offered a variety of plans, and this is the time if you're not sure about your Medicare Advantage plan, you may want to switch to another. You can do this during this period of open enrollment from today to December 7th. When you're looking at how you can cut costs as you're looking at these plans, make sure you understand what's covered and what's not. Of course, we talked about looking at how healthy you are. Also, you want to look at if you're not retired yet, can you save something for these healthcare costs now? Yes, you can. If your company has a high deductible healthcare plan and a health savings account or HSA, put that pre-tax money in the HSA that you can then use for retirement to cover these medical costs that might be quite high. And then also look at whether or not your retirement income can be reduced by for the formula that Medicare uses. So if you have Roth accounts, or if you have HSA accounts, or if you have a cash value life insurance policy, that money is not considered counted in those calculations. So that's something you want to look at too. Talk to a tax professional or a financial advisor about it.
Got to have so many strategies to make the best moves for all this. Sharon, thanks very much. Great information.